Now, you asked about Smile Direct Club. Now, Smile Direct Club just filed for bankruptcy, which is really sad for the patients because I had saw on their website that even after they filed bankruptcy, you still got to pay them. So I still feel really bad for those people that are in the midst of treatment and really are now having to look for somebody who'll take over their case because it's really hard to take over a dental case like when you've been moving teeth around if you didn't start it at the beginning. Because, if you started at the beginning, you kind of know like where you're going to lay things out and, move this tooth here to give room here. But if you hadn't been part of the puzzle from the get go, it makes it a little difficult to do. So that's really, it's hard sometimes to get an orthodontist or a doctor to take on like somebody else's case. So I feel really bad for those people that are in that Smile Direct Club left in that manner. But also, Smile Direct Club, you know, my understanding that they didn't really have a dentist on site. So you would go in and they would take a scan and then they would send it up to a dentist offsite. But here's the thing, they didn't take x-rays to my understanding, which meant that we didn't know, do you have any decay? Do you have any bone loss? What's your tissue health, right? They don't have any of that data. And what I saw clinically when I was treating patients, and this happened to me even like a year ago. I was in an office and I was treating patients, helping out, and I had a patient that literally had like 9 millimeter pockets. Like, so when we probe, 12 millimeters is like the worst. Okay, pretty much. I mean, you can go up to 15 or so, but depending on the tooth, because every tooth has a different. But either which way, that's really bad. And she literally, like, when I was probing and kind of checking her out, uh, her teeth were mobile. They were moving. And, had she had an exam by a dentist beforehand, before getting in those aligners, which then moves and shifts the teeth, right? Through the bone that's infected, but they didn't check to see if she had, healthy tissue or not. So therefore, her periodontal disease was eating up, and then they were moving it. So it's like two, because anytime you're moving, bone or you're doing something to tissue, think about it. It's going to cause it sore. It's going to cause it to be inflamed, right? But then you also it's already got an infection there. So now we're talking this stuff's moving a lot more. So ultimately, I felt really bad for her because there's really not much you could really do at that point because it was ultimately she was going to lose some teeth. And here she is, she spent this money on something she thought was doing her justice and it didn't. And that's one of the things, there was a lot of lawsuits out on them too, I think, as well. Um, and I hated that because I get the concept, right? Which was they were trying to make ortho more affordable, right? And I do agree that that is helpful, but I do think clear aligners has created a pathway for that, especially when you start putting AI and things a part of it, because then you don't have to go to the dentist every single time, is right? Then you don't necessarily have to, what a normal office visit would be, now it's not going to be as much because they can quickly look through them. Does that make sense? So I think for the consumer, AI in that regard is also going to be good for them because I think you'll start to see that. Plus, all the metal and stuff that's more expensive than even the aligners are, or they're continuing to get that cost lower and lower, right? Depending on the different types of plastic, because you do have to have really good plastic because you got to think we're moving teeth with it, so it needs to be of a certain caliber to be able to do that. But yeah, I'm a fan.
Cool. As far as I know, yeah, I didn't do it. I wanted to do it, but for me, I like the involvement of human dentist when I do something, and this one was completely online. You sign up online, they send you an imprint, and you take the imprint yourself and you ship it, and they send the retainers. So I was like, wait, I'm not comfortable with that, where nobody's actually checking me, but they're sending something. So
Yeah,
yeah,
and
thanks for
yeah, no,
clarification.
that's exactly right.